Go ahead.
Good afternoon, everybody. This is Bob Nolan. I'm the chair of the Community Relations Committee of the Health and Hospitals, and I hereby call to order the meeting of the Community Relations Committee for this Tuesday, September 14th, 2021. I'd like to call a motion to adopt the minutes of the May 4th meeting, 2021. And I need to poll each one of our members of the board who are here. So I'd ask for a yes or no vote from Jose Pagan, our chair.
Yes. Yes. Thanks.
Dr. Mitchell Katz,
Yes.
Ali Hernandez.
Yes.
Thank you. So all three vote in the affirmative. The minutes have been adopted. Scheduled today to present an annual verbal report of the following CARES, Health and Hospitals at COLA. Judith, thank you so much for being on. And Health and Hospitals at McKinney, and we know that we're waiting for McKinney. So I'm going to begin my remarks so that we can move the program along. Good evening, everyone. And I'm now in my 11th year as a member of Health and Hospitals. I never thought that was going to happen, but it has been. For me, it's been a very enjoyable experience, and I continue to look forward to being a member of this board. I hope you had a wonderful summer, but please remember, summer is not over. Enjoy it and have a good time. We've been very busy at Health and Hospitals as a system. I'd like to just highlight a couple of additions since our last meeting. It got great publicity, and I enjoy seeing it on New York One as Health and Hospitals, Gotham Health and Vanderbilt out in Staten Island announced they'll open a new diabetes center. And that's a great advancement because, as we know, diabetes is one of the great killers in our system. And many people do live with diabetes, but it's, in fact, our daughter has diabetes. And I'm sure that there are many people who are on this meeting whose family members have that dreadful disease. So we'll keep on battling it, but it's good to know that on Staten Island that this diabetes center has been opened. So I want to congratulate Dr. Katz and his team and everybody else who made that possible. I want to also announce that at-home testing for COVID-19 is now available to all immunocompromised New Yorkers and those age 65 and older from the New York City Test and Trace Corps, which made that announcement within the last period of time. I'd also like to announce that that Health and Hospitals Bellevue has opened its same-day surgery unit and state-of-the-art technology that will enable doctors, nurses, social workers, and other staff to provide advanced support services for patients, promoting a speedy recovery and allowing patients to go home the very same day. I would also like to make mention of the fact that next year, which is right around the corner, we'll be having our annual 2022 public hearings. So this is like an early alert to all of the hospitals who are online, who are listening to our meeting, that we want you to designate somebody or some persons who will attend that public hearing. It's extremely important that you attend and that you speak on behalf of your institution. So you'll hear more about that as we come closer to the first of the year, or really after the first of the year. I'd also like to make mention of the fact that I had a chance to go down to Brooklyn on August the 13th to attend the lunch in memory of our dear former colleague, Josephine Bolus. It was an awards ceremony. It was a chance for us to see her dear husband and her dear son. And it was good seeing so many of my colleagues who were there also to talk of Josephine and her wonderful contributions that were made. And I want to congratulate our board and congratulate everybody who made that day possible. Finally, I'd like to welcome, he's been to our meetings before, but he comes in a different capacity today, and that is Mr. Warren Burke of Kings County Hospital. Warren is now the chair of the Community Advisory Board citywide, and I want to congratulate Warren on holding that position. We spoke yesterday. I look forward to working with him and the CAB Citywide Advisory Board over the next year and perhaps longer than that if the bylaws allow that. And I'd like to thank Dr. Andrews for his contributions during the past year of service. Warren, I can hear you. Are you on?
Yes, I am on. Rob, thank you so much for those kind words. And we
and the executive
First of
board
many
and the
calls.
whole, huh?
I look forward to working very closely with you.
Thank you.
Okay, I am incredibly proud of of our Health and Hospitals Board and the work that the corporation does, even though we're not a corporation any longer. I look forward to getting back to the work of the community partnership to make sure the facilities on the ground serve the needs of the people to the best of their ability. I'm sure that that's being done right now at our 11 hospitals across the city, and we are looking forward to having a banner year. In the midst of this pandemic, which we'll get through, and we've gotten terrific advice and guidance from our own Dr. Mitchell Katz, and I now want to turn the meeting over to Dr. Katz for his remarks.
Thank you so much, Bob, and you covered a lot of the important recent events. We have seen a peaking of COVID due to Delta variant in the hospitals. Cases have been going down for the last 3 weeks, which gives us, much more peace of mind and happiness to not see so many people as sick. I think this is a direct result of the very successful vaccination campaigns throughout New York, and even among our workers. We're now past 80% of health and hospital workers being vaccinated. I'd say 4 weeks ago, we were at 65%. So we've made a lot of progress in the last few weeks. In what is now 13 days from today, will go into effect the requirement from the state of New York that all healthcare personnel must be vaccinated. That's not just health and hospitals, that's all of our facilities and all of our partners, the other private hospitals and government hospitals that are in New York State. We are very hopeful that the remaining people who have not yet gotten vaccinated will want to get vaccinated. We've been very clear with our staff that they will not be able to enter our facilities after that day, even if there are accommodations because of religious or medical reasons. They still will not be able to enter the buildings. So we are very hopeful that people will want to get vaccinated. Finally, just a note about the rain. It was a period of rain last week where the rain fell so fast that several of our hospitals flooded in the basements or had leaky roofs. This is a problem that many of the community advisory boards have dealt with before, which is that the people in health and hospitals, the staff, the patients are great. The buildings are often a little bit crumbling. We haven't put the same resources and investment into the buildings that we have to our program. So leaky roofs at Harlem, flooding at Jacoby, flooding at Elmhurst, need to take equipment offline because of the flooding. These are surmountable problems, but would require substantial investment. And we're currently working for the first time on having a master facilities plan that shows all of the things that need to be fixed in all of our facilities so that we can have a more thoughtful capital process. Thank you, Chair Nolan.
Thank you so much, Doctor, for bringing us that update and also the news of the impact of the flooding, which affected so many people citywide, and it impacted us too, and that's understandable. But yes, the funds will have to be found so that those hospitals will be brought back to the better condition, both the roofs and also the flooding perhaps in the basement that impacted on them. But thank you so much for that up-to-date report. We're going to move on. We're going to hear from the two facilities that will present their verbal annual reports. Today's reports are brief but focused because we're exploring ways to make the report even more meaningful to the CABs of the CRC committee. We'll continue to learn and fine tune so we can always continue to improve. Each presentation is allotted 5 minutes, and we're grateful for the work that went into preparing them. Thank you in advance to our speakers for their time and commitment to the system. I will introduce from COLA, Judith Purdy, and thank Judith so much for once again participating in our hearing. Judith, the floor is yours.
Thank you very much. As you see, the entire report is online, so I will not read it. I'll just point out a few of the highlights. Kohler is continuing to work through the COVID, and we're doing very well. 94% of the residents are vaccinated. Up to over about 75% of the staff are vaccinated, and there is a constant publicity to get vaccinated. And a few more got vaccinated today, but I don't know what's going to happen. There are almost 200 people there that still have not been vaccinated, and we cannot spare that much staff. And we're working very hard to motivate them. We're following all the guidelines that the state has put out. As to visitors, they were off campus. We have some residents who can have compassionate care visitors, and the system seems to be working out very well. This summer, we've had wonderful weather, so we've had a lot of outdoor visits in the garden and in other areas of the campus, and that seems to be doing well, and the residents and the visitors seem to be very happy. Still working on infrastructure. We did have a little bit of flooding. Last week, it went into the Catholic Chapel, and the only areas that it hit were staff offices. It did not go into any patient care offices, and it was quickly remedied the next day. The hospital is Kohler is continuing to upgrade with new TVs, with better Wi-Fi, especially in the patient areas, stronger Wi-Fi so that people can have more internet access. They're also installing broadband and expect to all to be done soon. We have an organization called Plaintree, which is guiding healthcare facilities in building patient-centered care and enhancing the patient experience. Plaintree works with healthcare organizations on an international level and is recognized leader in the field of patient-centered care. As part of the program, the CAB and auxiliary members, residents, family, staff have participated in focus groups, generated valuable information that will help guide the journey. And there are some things that they have taken place. They've made progress, and it's all listed in the report. There have been some complaints by some of the residents about clothing being lost and things that happen when things were in storage, but they have all been identified, and the residents have, the situation has been handled, and anything that was lost, they were compensated for. Sometimes when things are done in a hurry, things seem to get a little lost, but the residents are happy. And this is their home. It's very hard to keep all your possessions where if you're living in a 4-bedded room, and we have storage areas and things like that. And so that's a challenge, but Mr. Hughes and staff have been working on that. We were also listed in Newsweek's top 10 ranking of best nursing homes for 2021. The ranking is based on performance data, peer recommendations, and facility handling of COVID-19. The Kohler also has a 4-star rating and has a perfect 5-star rating for quality for staffing. Kohler developed a very good palliative care unit, which is meeting the needs of the seriously ill. And if anyone has any questions or comments, I would be glad to answer them. I know Mr. Hughes is also on. And thank you. And we look forward to welcoming everyone back to Kohler's beautiful grounds next year.
Thank you so much for your report. Thank you in particular for highlighting the vaccination rate at 90% and the staff vaccination rate is 75, because I had highlighted that. Thank you for giving us the number of the unvaccinated and letting us know about the off-campus ability or at least that tent that's been set up for people to come and visit their loved ones. Because probably nothing more critical now. Everybody has learned a lot from the beginnings of this pandemic about how to handle this type of visit. I think that that's a wonderful thing. I also want to highlight the work done by your auxiliary and all the auxiliaries across our system, because they do outstanding work. They raise quite a bit of money, and they're able to purchase for the hospitals those things that otherwise are not able to be purchased by the central office. So a salute to the auxiliary at Kohler as well as the auxiliaries elsewhere. I open up the floor to any other questions that might be presented by our committee members. Would anybody like to ask a question?
No, I just think that the rating is spectacular.
I was going
Sally?
to say the same thing. So
The rating is
congratulations.
Right. And I just have one comment that I was reading about another private nurse, not-for-profit nursing home that just was bought out, and how horrible the situation has become. And I'm so glad we have Kohler and the city facilities, and they're not, being bought out by private companies that are just seeking to downgrade service and make money. That's my only comment. And I'm very proud to work with Kohler and H&H.
Thank you very much. We really appreciate that. I'd like to move on. If we Kalisha, do we have McKinney on with us this evening?
Yes, they are.
Oh,
McKinney?
then I would like to introduce the representative of McKinney, and that is Mr. Antoine Jean-Pierre. Mr.
Yes,
Jean-
good evening. Can you hear me?
Yes, I can.
All right, thank you. I'm working on the video as we talk.
Okay, but we can hear you
Is it
loud.
my turn to go?
Yeah, go right ahead. Go.
Okay, good evening, everyone. This
Good
is
evening.
reported from Dr. McKinley facility. COVID-19 at McKinley left an experience no one will ever forget for an exceptional long time. From the onset, we had our own challenges, as all others post-acute care centers. The most challenges were we were fighting something that was invincible, and no one had answers, and we did lose some residents and one staff member. Immediately, so much was taken away from the residents that in itself was challenging. Now how do we help them understand what was going on? Once our plan of care was implemented, we were better prepared. The amazing team of McKinley worked diligently to ensure all clinical measures were in place for everyone. The infrastructure and equipment. During the COVID project that was already earmarked were being executed and continued to today. As a post-acute care center, operations are much more different than that acute. Some infrastructures had to be placed on hold, such as the in-house dialysis, because that space is designated as a COVID suite, which takes precedence. However, new elevators were put in, a new morgue was constructed, a new learning center, and all residents now have free telephone service. A clinic coronet system is now in place for keeping all families informed of any adverse activities in a timely manner, and a remote rehabilitative site was set up for the subacute residents and the rehabilitation suite areas. In alignment with the safety standards, a new Vanguard system was put in place along with a new camera system. We have always followed all New York State and DOH policies to ensure the safety of both residents and staff. Residents were happy with the modified projects and programs put in place by Therapeutic Recreation. Contact with families were done daily through FaceTimes and phones. For safety, one designated COVID suite is still operational. Cards from the community were again distributed to residents on Mother's Day and Father's Day. Frontline staff workers must be commended for their tireless effort in ensuring that care was never compromised. And finally, the frequent complaint raised by residents and patients The only complaints residents had was the non-contact with their families. But as time lapsed, FaceTime and window visits were put in place to help alleviate anxieties. Visitation continued for qualified compassionate care. Residents were kept occupied by the staff of the Therapeutic Recreation Center. And the McKinley spirit is always present. It is amazing to witness the staff as they adopted each resident with love and compassion during the difficult period. The care and compassion from staff leave us a community advisory board satisfied with the quality of care given to our residents. Sincerely, the McKinley staff. Thank you very much.
Thank you very much for presenting your report. I want you to know that when I was down at McKinney for the luncheon for our dear former colleague, I got a chance to see firsthand how well McKinney was operating, how well you had the beautiful outside garden area. I don't think any of us minded the fact it was 92 to 95 degrees because of the company that we had, and they also because how well the hospital maintained its facility. So thank you very much for your report. I'd also like to make mention of the fact that some of us have found out that while Josephine was recuperating down there at McKinney, she was on the phone calling the appropriate people to try to get those elevators installed. And I understand that in the end, she was successful working with, I'm sure, the senior people at McKinney to make it happen. But that, all of us who know and remember Josephine Bolus, she would have it no other way. She wouldn't just be able to lie there in bed knowing that there were elevator problems without going in and trying to make it happen from her perch. And she did that. And that's the lovely and wonderful Josephine that we all know, love so much and miss. But thank you so much for your report. I'd like to ask if the other members of the committee have any questions of the presenter and the chair. Hearing none, I want to thank you so much, Mr. Antoine Jean-Pierre, for your report from McKinney, and thank everyone down there for all the fine work that they're doing. I'm now going if there's any old business, and I'm going to also ask if there's any new business. And I'm not hearing anything up here in the Bronx, so therefore I call a motion to adjourn this meeting. Thank you for your support. And for today's meeting, stay well and be safe.
Thank you,
We
sir.
are.
Thank you.
Thank you.
Thank you, everybody.
Thank you.
Bye.
Evening.